Okay, welcome everyone to pre-launch webinar for Mold Illness Mastery course. I'm very excited to be running this new course with Dr. Amy Dirksen, who is a naturopathic physician from Seattle. How are you doing today, Dr. Amy?
Doing great.
Excellent, excellent. And we're very excited to be launching this course in early February next year. And you guys today get to have a sneak peek into what we're going to be offering in this course, and you have the opportunity to sign up at a discount as well. Our institute, which is known as Lotus Institute of Holistic Health, has been offering courses in mold illness now for around 8 or 9 years. However, the main course, known as Mold Illness Made Simple, has been for the public, and we've never really gone deeply into protocols and case studies and things of that nature for practitioners who are really looking to improve their clinical skills in this really important area of healthcare. So we're really excited to then be kind of jumping into this area where we'll be looking at a very practical approach to looking after patients and clients with various forms of mold illness. So without any further ado, I'll hand you over to Dr. Amy to introduce herself and how she got interested in all of this.
So thank you for having me. So I'm a naturopathic physician with full scope of practice here in Washington State. I've been doing this for over 20 years now, which is aging me a little bit, but that's all right. You know, in that time, you learn a lot. And I was really lucky as I came out of naturopathic school. I did my residency with Dr. Dietrich Klinghardt, who specializes in chronic illness and Lyme disease. And so my framework right from the beginning not only used a tool called autonomic response testing, which helps kind of test things that are outside the box, when your labs look normal, but you feel really crappy. A really nice tool to kind of figure out what the hierarchy is and how to work with some really complicated patients from the beginning. And he also opened up a whole world of connections for me. So from the conferences that he was teaching from early in my career, I got to know so many of these big name people, just on a first name basis. And I got to, call and consult with them and really wrap my head around some of these things. My background was, I had an undergrad degree in biochemistry. So I'm a bit of a nerd. I love my genetics. I love working up mitochondrial function and methylation. And so I'm always thinking that way. But then I'm very sensitive energetically. So I do this autonomic response testing to kind of connect the two worlds and see where that is. I'm particularly interested in mold. I started working with autism and Lyme at the beginning, but a lot of times what we would see is maybe they weren't responding to protocols, or, they were so sensitive and you had to look outside the box to figure out what's going on. And mold is often an issue. It's like gasoline on a fire. And so you have to become aware of how do I identify that? And over the last 20 years, the ability for us to do lab testing and the schools of thought on how to treat this have really improved so much. And, one of our goals is Sandeep and I were connected together from, some of our colleagues who know that we also do this ART testing to be able to present to you, how have we navigated through all of this research, all these various protocols and big name things that are out there. And how can we cut to the chase? And, our goal of this course is to, kind of bring those years of experience to you to, kind of make it a little more digestible and actionable. And I also have an autoimmune illness that was triggered by mold. Initially, back in college, I had to evacuate my clinical practice because of some mold growth there, and literally put all of the furnishings and everything in the parking lot and a free out on Facebook. And, you start from scratch. And then at my home right now, I'm right in the middle of remediation. So, you identify it and then you keep dealing with it. So I can deal with it personally and clinically.
Yeah, great to have that practical experience of dealing with mold, as well as just the theoretical side of it as well, to be able to help guide people through the remediation side of things, I think.
Yeah, so. No, it was interesting having had, the irony was when we started writing this course, that was the day that I discovered this water leak and all this mold growth all over the wall. And it put things into context. It's one thing to clinically know something, but it's another thing when it's your house and you're like, oh my gosh, where do I start? What do I do first? What do I treat? Who do I call? And so that really has helped with my framework as, we're writing this material, is what are the steps? What's the sequence of how to deal with some of this stuff? And I'll definitely be sharing that as a case in our big course.
Yeah, great. Yeah, wonderful. Well, great to have you on board.
About you.
Yeah. Well, a little bit about me. Some of you may already know me, but basically I'm an integrative family physician in the Sunshine Coast in Australia, hence the accent. I've done a master's in nutrition back in around 2009 with Dr. Gabriel Cousins, and what's called a fellowship in nutritional and environmental medicine. And that was very, very eye-opening. And this was after I actually myself became unwell after taking some very strong antibiotics after traveling over in your side of the world, Dr. Amy, well, Oregon. And so, yeah, I remember my experience at the time was I went to see the specialist at the hospital I was working at, and with these really bad headaches I was getting, and they wanted to put me on a really, really high dose of prednisone. And I remember at that point, up till then, I'd been a very obedient follower of the conventional medical system. But at that point, my intuition kicked in very strongly and really just came up with the idea, well, hang on, something's got to have caused this. It's got to have been related to those antibiotics. I've got to find out what that did to me. And I guess you could say that was the first question which led me to this whole area of healthcare in functional medicine and integrative approaches. So my particular experience in mold illness was having a house flood in 2012 here on the Sunshine Coast, and my partner at the time became extremely unwell, in fact, bedbound. And so my initial interest was in trying to find some help for her. And I remember some patients actually came and mentioned that there's a certification in mold illness for physicians. And I just signed up, no questions asked, literally instantly, because I knew I had to learn more about this. And that took me on a whole journey of learning about this, reading a few 1,000-page documents and just taking a deep dive into understanding how to deal with this. And so after doing the Shoemaker certification and being certified for a few years, I then broadened my approach to mold illness and have looked at a variety of different influences and studies, and so eventually come up with my own understanding of how one can best deal with mold illness in all of its different forms. I've also been to many, many trainings with other different teachers and doctors, including Dr. Klinghardt, Dr. Larry Afrin, who is considered the world expert in mast cell activation, and many, many more. Too many to mention, actually. But that's a good little intro.
Yeah, and I think that prompts, our motivation for the course is how do you make all of the material that's out there clinically useful? And that's what we're really hoping to share with you, all of you.
100%. Yeah. So do you want to jump into this then,
Sure.
Amy? Yeah.
So today we're going to talk a little bit, this is just a snippet. So an overview of what mold illness is, how one can be diagnosed, some of the treatment modalities, some of the challenges that we deal with mold, and then we'll get into the details of our course there at the end. And for those of you who hang on, we have a nice, juicy little discount code at the end. Okay, next slide. So mold-related illness, the mechanisms for how it can trigger problems, there's a multitude, and that's what makes it so complicated, and sometimes identifying it and figuring out the right treatment, and why no one treatment is going to be right for everyone. So there can be chronic inflammation, there can be allergy or mast cell histamine type issues, there can be colonization, and this is the Australian spelling of colonization, it's not a typo, which is the actual growth. So a lot of times we'll see that growth in the sinuses or in the gut, even once you're out of mold. There could be mycotoxins. So mycotoxins are the chemicals that are excreted by mold. So these are more of a detox need that you would have, but those can stay in the fatty tissue for years and years and can stay in the environment even once the mold is gone. And so it's often the mycotoxins that are making us sick, either in our body or still in our environment, and they don't have a smell when they're in the environment. And that's the thing that's a little scary. It can be toxic accumulation. A lot of times what we're seeing is liver toxicity, accumulation in the tissues. People who struggle with methylation and mitochondrial issues just aren't able to get this out. or they're just severely constipated and not able to excrete. Some cancers are thought to be related to this. Autoimmunity and PANS, this is something I know well as having years and years of experience working with autism and PANS pandas, which is more for some people that it can trigger an autoimmune type reaction that's actually causing inflammation in the brain. And we see a lot of behaviors. So it's not necessarily, looking like you have sinus congestion or looking that you're toxic. You're actually just feeling completely out of control or having so much significant brain fog that you can't function. SIBO and SIFO, there's a lot of talk of that in functional medicine, the small intestinal bacterial overgrowth or the small intestinal fungal overgrowth. And a lot of times that is actually coming because things are out of balance, and mold is often one of the causes of that. So, if you're finding SIBO in your patients, which we're seeing a lot, if you do stool testing, you're seeing a lot of the SIBO, think, okay, what's driving this in the first place? The other thing that's not talked about as much as I wish it was is this bile acid changes that can happen. So a problem in concentrating the bile and with bile flow. And what we see with that is a lot of times maldigestion. We see with a lot of our patients like this upper digestive fullness, difficulties tolerating fats, especially a lot of nausea, sometimes liver enzyme or bilirubin elevation, and just they're not getting these toxins out. And why we care is these fat-soluble toxins, the mycotoxins, or let's say you deal with Lyme disease and you're dealing with those biotoxins, they are all fat-soluble. That's why they love the brain. The brain's a big fatty thing, right? But the only way for us to get that out is it's concentrated in the bile, goes out in the stool, and leaves the body. And so when that is compromised, which we see in mold illness, we have a big problem. And so a lot of our patients are needing a lot of help with bile flow. And then there can be the cell danger response, which is essentially mitochondria shift from this oxidative stress, and it goes into a self-perpetuating process. So that's Dr. Navio's method. Let's go to the next slide.
Yep.
And if you want to add anything to any of this, Sandeep, holler.
Oh, that's great. I'll leave it for now.
So when you should suspect mold illness, honestly, when I suspect mold illness in my practice, I'm, like I said, I'm not a last stop. I'm like the 20th stop. So I suspect that when someone's not responding as I think they would. So let's say they come in and they're diagnosed with chronic Epstein-Barr, and you throw all the normal Epstein-Barr treatments at them and they're still stuck in this cycle, or just things aren't working. You look back, you're like, this works for everybody else. Or, I've been really creative. What is still stoking this fire? You've got to be thinking mold. If you have multi-system illness, I saw someone today as a new patient who has 8 different specialists. You have to step back and go, you don't have 8 different diagnoses. There's a common problem. And a lot of times it's mold or some sort of chronic infection. MECFS or MCAS, which would be that, we're thinking the histamine issues, or the chronic fatigue or fibromyalgia type symptoms. Again, something's stoking that fire. Something's causing those issues. Mold is commonly one of the things there. If there's been a water leak in their house, a lot of times people, downplay this, like, oh, it was just my water heater that leaked. It's in the garage. It's no big deal. But that every time that the doors open and close, those mycotoxins, like I said, that don't smell, those get sucked into the house, and those can make you just as sick as the actual mold. If there's a history of water leaks in the home, or they live in a damp area, like here in the States, do you live in Florida where there's hurricanes all the time and flooding, or you live down in the South where there's a lot of humidity, a lot of times that can be a driving factor, or they grew up in a home full of mold. Again, those toxins can stay stuck in your body. Static shocks and vibrations. I see this a lot from some of the electrolyte and mineral imbalance. So people who always shock themselves every time they touch an outlet, or they feel that internal buzzing, I'm very suspicious of mold. The allergic shiners, which I probably have them now because I'm in the middle of mold remediation, just these dark, kind of puffy circles under the eyes, really pronounced in kids, sometimes harder to see in our adults, because they use makeup and whatnot. But that chronic puffy eye, there's just this look that often screams mold or some sort of environmental reaction. And definitely chronic sinus issues. So many times we focus on the bacterial component, but if someone's done antibiotic after antibiotic or herb after herb and it's still coming back, there is a fungal component. There's no way that there isn't. And a lot of times it's mold colonization in those sinuses. Okay, next slide.
Yeah, that's great.
So preliminary testing when you're suspecting mold. So number one, take a good history. There's no lab test that's going to replace that. Ask them about their living environment, because that's the thing as a clinician we don't get to see is what kind of space are you living in, and ask details, because people do get defensive. They think that if you think that there's mold, that somehow that means that their house is dirty. And some of the worst cases of mold have been these multi-million-dollar houses that are just too airtight and there isn't good airflow happening there. So definitely take a good history. Has there been a roof leak? Have they ever looked, is that toilet always running? Is there evidence of water damage there? Investigate the previous living spaces that they lived in.
Sorry, do you mind if I jump in there real quick and just add that? Yeah, I guess what you're saying there is if you just ask someone, do you live in a moldy home? You're often just going to elicit those kind of automatic defenses, and the classic thing is, well, no, I don't. They'll classically say, no, I don't. And then if you delve in deeper, and in the course, we'll talk about a lot of the questions which can help you to tease it all out. Often there are signs there, but just a very basic question like, do you live in a moldy home, won't actually elicit that.
Yeah, and it was interesting with that patient I mentioned that I saw today that had all the specialists. I just asked, is there any suspicion of mold for you? And she said no. But then when I asked further, yes, in the last year, they actually had flooding. It was a slow flood that happened in their basement, and there was a bunch of mold found under the house. And they left as soon as they found it, had it remediated, but didn't think to tell me until I specifically started asking those questions. It was really interesting. So.
It's quite amazing what people will write off as being normal, isn't it? That's one thing I found. So it's almost like you can't assume that people consider anything to be abnormal. And so you have to ask for it specifically.
Or in their mind, it was dealt with, right? There was a flood, they dealt with it, and now it's there. That can't be still related. And that's the thing. It's just because you don't have mold growing all over the walls of your bedroom doesn't mean it can't be impacting your health.
Right.
It can be in the HVAC system, or it can be those mycotoxins.
Right.
The other thing when looking at a history, so if we're not suspecting the home, and we'll get into some of the tests for the home just to look closer, right? Because it's not always so obvious. But it could be coming from their work environment. I see here a lot of people at in some of the buildings at Boeing, they're exposed to a lot of chemicals, but there seem to be some mold in some of those areas. So nothing against Boeing, but some of the schools, especially some of these modular units at the schools, can have big issues with mold. A lot of times when we're asking teachers, they're getting migraine headaches and some of those things. So that can be a indicator there. Or I had a young child recently, and she was going to grandma's house, and grandma's house had a mold issue. Had we not really asked a lot of those things, and it was triggering an autoimmune illness for her, and pretty significant joint issues. And so it was that you're spending actually a lot of hours there. So that can be a problem. We'll talk about investigating the home. So some simple ways to start would be ERMI testing off the dust or these mold plates to actually look for mold spore growth. And then there's some screening tests. The VCS test, which we'll get into, which is an acuity contrast testing, some simple blood testing, and then I'll talk a bit about organic acid testing, and we'll get into some of the specifics of the fancier tests too. Next
Great,
slide.
Thank you.
And I'll let you talk about this one since you do this more.
Okay, yeah. So visual contrast sensitivity testing. It's a kind of a part of standard eye examinations by optometrists and so on. But what was found, and I think particularly when Dr. Shoemaker was looking at physteria, which is the first condition he looked at, they published a number of papers basically showing that there were deficits in visual contrast that were able to be detected. Now, it's not only mold or biotoxin illness that show defects in visual contrast. So one of the first things that people need to know is that, if you've got eye problems, that can also cause deficits in contrast. So generally speaking, particularly when you're doing the face-to-face test, you need to make sure you've got decent visual acuity before you do it. And then basically, when we're looking at it with regard to biotoxin illness, it's the C and D columns that we look at. And so with regard to chemicals and heavy metals and so on, often they show up more in the B columns. So it is something that can be used, but just be aware it doesn't have 100% sensitivity and specificity by any stretch of the imagination. So, it will miss some people. So, I guess you don't want to hang your hat on it. But if it does show up positive, it's actually very useful to use as a kind of a form of monitoring. So you want to see that the visual contrast is improving as we go along the line with treatment with binders and treatment for colonization, etc.
Yep, and this is the test patients can order. They can sign up online and do the
Yeah,
test
you can do. So this one here is vcstest.com. I believe that's a free version. And then there's the other one on Dr. Shoemaker's website, which is survivingmold.com, which is spelt the American way, MOLD. I think it's roughly $15 to $25 US per test, depending on whether you buy just one or whether you buy multiple tests. So yeah, it is something you can do if you're if a client's concerned about VCS testing, you can get them to do try that again. If they're worried about mold being an issue, you may want them to do the online VCS testing. But I think the more sophisticated you get with this, probably the less you rely on that.
Mm-hmm. True.
Okay.
We were going to have you talk about the
testing. Yeah. Okay. So this is what's known as the ERMI test. So this was developed by the U.S. Environmental Protection Agency as a research tool. And basically, it is a form of PCR testing that takes the sum of water damage molds or harmful molds and then subtracts the common indoor molds, or almost they're suggesting they're helpful molds. And then it's basically there's a logarithmic graph, and it comes up with a score based on the sum of the logs minus the sum. Yeah, basically the sum of the first group minus the sum of the second group. And so it basically comes out. You can have a negative number. Well, I think it starts from -5 and goes up to a maximum of around 25. And so originally it was taught that you need to have an ERMI of less than 2 in order to recover from CIRS, which was Dr. Shoemaker's term for mold illness, and that if you had a particularly high C4A value, which is one of the inflammatory compounds he used to look at, you need to be less than -1, which is actually quite rare. So it was research with regard to mold illness by the Shoemaker Research Group. So it is something that can be used, but there have been cases in which ERMI has not identified a problem as well. So just be aware it does have some limitations.
Yeah, one thing I would add is the ERMI test. It's relatively inexpensive and can be a really good screening tool. Like if you're looking to buy a house or move into an apartment, one thing you could do is you just take your little Swiffer cloth and a Ziploc bag with you. And as you're going through, you can just collect your dust samples, and you can pay a little extra and get your results within 1 business day often. So if you're needing that quick turnaround time, it can be a really nice screen of like, is this place even something I should consider?
Yeah, great point. Then the HERTSME calculation, did you want me to do this bit?
Yeah, just the next few slides on the home piece.
Okay, great. Yeah, so this HERTSME 2 score, I'm not even going to try and remember what it stands for right at this point. But it was considered to be like a derivative of the ERMI testing, where they basically looked at 5 different mold species that they found to be the most predictive of whether you're going to react to a building or not. And so those were the Aspergillus penicilloides, Aspergillus versicolor, Chaetomium globosum, Stachybotrys chartarum, which is the most famous mold, you could say, in terms of health problems, and Volemia sebi. So basically, depending on what the scores were, so if you go back to the previous slide, you'll see the scores, they are basically run anywhere from not detected up to tens or even hundreds of thousands of points. And so if you're very high on a couple of these, then your score is going to be like 20 or above. And so that's going to be dangerous for those with chronic inflammatory response syndrome. But if you're pretty low, like almost all of your mold species are lower than these levels, and maybe just one is in this level, then you're going to fall into this statistically safe for re-entry for those with CIRS. So there has been a paper published on this by Shoemaker and Lark where they found it was quite predictive of which patients tended to relapse and which patients didn't. So that is sometimes you can just purchase HERTSME-2 as a standalone test, and it's a little bit cheaper than ERMI. And so, yeah, it is something that has been looked at, and it's good to be aware of that. And you can calculate the HERTSME-2. So let's say you got this result here. You can go in and find the Aspergillus penicilloides, and then go and mark it down. It's the second column here. So in this case, 116 puts us in the second column, so that gives us 6 points. And then you go ahead and repeat the same thing for every, or for each of those 5 mold species, and then you come up with a final score, which is in one of these 3 categories. So that's how one calculates the HERTSME-2 score.
Yeah, and I think the thing I would add is even if that comes back in the clear, but you're still suspicious in other ways of mold, it doesn't mean your investigation stops. But if it comes back and it's a problem, then you already know you have a problem.
Yeah, that's right. And after a while, through the history taking, you come to be able to tell what subtle signs there are that your patient or client is reacting to a building. And so what you don't want to do is ignore those signs just because an ERMI test or a HERTSME-2 test are coming okay. So ideally, we want to treat, and it's a very common adage: treat the patient, not the test. The test is only some supplementary information. But for instance, if the patient says, "Hey, I went back into my house after this remediation, and hey, I got massive fatigue and brain fog and skin rashes," you don't want to say, "Oh, well, your ERMI's fine. You're making it up." That's what things go.
If you're reacting to something, it might be mold, it might be chemical, or who knows.
Right,
but
yeah. But you're definitely reacting. If they give you that kind of history, then they're definitely reacting to the building. And so it doesn't always follow the rules, you could say. If the history is telling you that the patient's reacting, then that's the most central thing. Now, the tests can help you to determine, is there any particular species that the building is really, really high in, or is it just generally moderate levels of a whole bunch of different molds and so on. So that would be an example of the information you can get. Now, mold plates are another example of a screening modality, if you like, for mold and dampness in a house. And so generally one thing about it is you're able to test many different rooms at a reasonable price. While with ERMI, you generally would only pay for one, because I would say it's roughly $350. Is that right, Amy?
I think we can get it for about $250 to $300 right now. Yeah.
Okay, great. Yeah. So, but I think generally speaking, most people would only purchase one, right?
Yeah.
In general, right? While with mold plates, you can, they're more economical, so you might purchase 5 or 6 and put one in each room. Now, the thing that's most impressive about them is if it grows something like what you can see on the left here or on the right, that's a very powerful visual motivator. And and for that person, they're then gonna see, whoa, there really is some mold here, and it may help them with motivation. So generally speaking, it's mainly used for that purpose rather than being more of a final determinant of does the house require remediation and that kind of thing. So, but it's a screening test, and if it is positive, it can be a powerful motivator. However, if it's negative, it doesn't exclude. You're probably going to hear us saying this over and over. If it's negative, it doesn't totally exclude it, and the history will often tell you. So then the next question is when to actually recommend a professional mold inspection be done, because there is a certain degree of cost. In Australia, it's often minimum of $700 or $800, and then if sampling is done, then it goes to often around 1,500 to 2,000. So I guess a little bit less in the US, I imagine, but somewhere in that same.
Oh, it gets expensive quick.
Yeah, that's right. So people want to know that your clients will want to know that it's really indicated and that you're not just, you're just giving it by rote, giving that recommendation by rote that everyone needs to get their home inspected. And so one indicator is positive screening tests, just like we mentioned. If you've got positive mold plates or Hermie, then what we need to do is go and do we need an inspector to come and do in-depth moisture mapping so we can get an indication of where is the problem in the home, or is there multiple places where there is moisture in the walls or ceiling or floor, and can we identify what has taken place to lead to this problem with dampness and mold. So that's essentially just like in functional medicine. Ultimately, we're always looking for the cause of the patient's problems. In this case, the purpose of a mold inspection is to identify the cause and then to come up with further recommendations, i.e., is remediation likely to be possible or not? And if so, to come up with a scope of work for remediation. So that's the purpose of getting a professional mold inspection. Secondly, lack of progress. And I've seen this a number of times, if you're treating someone for mold illness, and despite appropriate treatment and adherence, they're not improving, well, I guess one side of things is always to have a broad net and make sure you've addressed all the issues, like is there stealth infections present? Is there mast cell activation? Is there EMF? You want to be pretty broad. But if you've looked at all of that and addressed all of that and there's still no improvement, I believe that is a very strong indicator to recommend a professional mold inspection, because often there will be hidden mold problems in those cases that is impeding progress. And then lastly, I guess you could say it's not really an indication, but it's just something to be aware of. If the patient or the client owns their home, you're more likely to recommend a professional mold inspection, while if they're in a rental property with a relatively short lease, it's going to be less beneficial, because in many cases, landlords will not agree to carry out any remediation, and it's generally not legal to go and do structural remediation to someone else's property. And even so, even if your landlord or real estate agreed to it, investing a lot in terms of doing structural remediation is probably not going to be indicated if you don't know how long you're going to be in a certain property. So generally speaking, the solution in a rental property is more likely to be move on and try and break the lease and get out of there without any penalty. While owning the home, there's a lot more investment, and therefore that's generally where remediation would be considered.
Yeah, and I have seen if you're renting, if you've done an ERMI test or the mold plates and you have those results, I have had people use that to get out of the lease. And a lot of times we'll present, as a doctor's note, I would just say they're allergic to molds and we identified this. Then the owner of the building tends to be less defensive about that, because people understand allergies more than they understand, oh, you're saying I've poisoned you.
Yeah, they're great tips. And actually, these are certain points we will go into in our online course, because that's actually very common. Having a patient basically asking you to write a letter to try to get out of their lease or something, or to their employer, and just being able to navigate those situations is an important skill if you're going to be treating mold illness.
Yeah.
Okay, over to you with this one, Amy.
Yeah, so these are some screening labs that might indicate that there's an issue, and these are some of the basics, right? Because people don't always come to you saying, you know what, I'm a mold patient, or it's not always mold alone. And so I think it's really useful. I only run labs if it's going to change the course of treatment, but this would be typically sometimes even before I've seen someone, I would order these labs on them. Mm-hmm. So a homocysteine, very, very helpful. So your ideal range is going to be between 6 and 8. the normal range, a lot of times listed like on LabCorp or Quest, which are our sources here in the US, sometimes go as low as like 2 up to 15 as being normal, and that's dumb. So you want it in this tight range. And if it's elevated, you're really suspicious that there's a methylation issue, which means that intracellular ability to detox some of these heavy metals and these mycotoxins and some of these, and to repair the DNA, so that that's not working. And that's going to start driving some of this inflammatory process, and especially more cardiovascular related inflammation and sensitivity and this accumulation of toxins. So if that's the case, if it comes up high, then I need to explore some methylation treatments, some B12, some folate, maybe some B6. And then you can monitor that homocysteine level and see if it's coming back down to normal. High sensitivity CRP, again, getting into some of that cardiovascular inflammation, but normal should be under 1. And if it's higher than that, and sometimes I've seen it really high, 5 to 10, there's a lot of inflammation going on. And that's where we start investigating, okay, are you eating really terribly? Are you doing something? But a lot of people, who've ended up in our practices have already, cleaned up their diet, they're low sugar, they're doing all the right things, but there's still all this inflammation. So again, that's a flag for you. What is stoking this fire? Where is it coming from?
Exactly. And I'll just mention that. Do you mind if I just jump in with one thing?
Anything.
Sorry, Amy. Yeah. So, classically it was described, by the Shoemaker research team that the ESR and CRP won't be raised, and you'll only get raising of novel inflammatory markers like C4A and TGF-beta1 and so on. However, I've also found that it doesn't necessarily always follow the rules when that is concerned. So sometimes it will actually include the IL-6 pathway, which is when you get elevated C-reactive protein. I just thought I'd mention that.
Well, and it's cheap and it tends to be covered by insurance, right?
Yeah,
and if you know that, and it changes pretty quick if your treatments are working. And so I love looking at these, because if they're out of range, I know I have a very inexpensive marker and a real-time sort of marker to see, are we making progress?
Yeah, but then again, our usual rule applies. If it's low, it doesn't exclude it.
It doesn't mean there's not inflammation going on. There's just not that type of inflammation happening.
That's it. Yeah.
But again, these are just some screens, some tips of like, I need to be investigating something bigger is going on. So histamine and tryptase, I don't always do this unless I'm thinking more histamine or mast cell allergic type symptoms. And it is really hard to get a positive result. If it's positive, you've got some mast cell issues or some histamine issues. This is a big one where if it's negative, I'm still looking more at the symptom picture. And we have a slide later on some of these.
Yeah. And you guys have got serum heparin and all these other tests you can do in the United States, which are really great.
Yeah, but are they often covered? They get so expensive. So, you can get really creative if you want to, but it's not, what we're talking about here is like, where do we start? What are the things that are covered and easy and that would apply to anyone, even if they're not a mold patient?
Gotcha.
A CBC with diff, actually really helpful. And I'm not looking at what's in the normal range. I'm really nitpicking. So do you have that high normal eosinophil? If we have an eosinophil level, usually over 3, I'm thinking more allergies. So something is driving more of a histamine thing, and antihistamines might help that patient. Or do you have chronically low or chronically high white blood cells? Most adults have a white blood cell count somewhere between 4 and 5.5. If it's under, I would say if it's under 3, there's something really suppressing their system, which could be mold, it could be Epstein-Barr, it could be something else. Or if it's elevated, there's more of this acute inflammatory process. And that also, for me, guides treatments quite a bit. It's like, do I need things to upregulate their immune system or downregulate their immune system? So I use that as a little hint. The other thing within a CBC and diff is you could look at the MCV, or the mean corpuscular volume, which is the size of those blood cells. And I would say if it's over 98, again, you're thinking more of a methylation issue, that you need that B12, folate, and B6. Because that means those blood cells are too big. Cholesterol. Sandeep and I were talking about this the other day and added this in, because sometimes what we're both seeing is that the cholesterol is running high. So normal should be under 200, but I've had some patients, my skinny little ladies who are here who eat perfectly, have a cholesterol level of 300. You're like, okay, what's going on? And I always think of this, and I'd be curious your thought. Cholesterol is a way, I think, of the body trying to protect the nervous system from something and trying to protect itself. So if you're seeing that and it's out of proportion, I would say to their diet, they're not obese, they don't have a strong family history of that, they probably have a negative calcium score. I would be suspicious of what's the body trying to protect itself from.
No. One little point there is a lot of people seem to end up going on like a carnivore diet when they've got mold. And so one thing to keep in mind is some people do have a dramatic raise in cholesterol with that kind of diet as well. I think the reason a lot of people do that is because of oxalates and salicylate in sensitivities. So anyway, I just thought I'd throw that in as well. That's another little consideration.
Yeah, for sure. But I think it comes back to also, there's issues with the bile acid conjugation and some of those things too that can be driving.
Right.
Hemoglobin A1C is another one. So normal is going to be under 5.6%. And a lot of times I see this as an early indicator of just inflammation in general, if it's becoming elevated. So if we're seeing this sort of pre-diabetes type picture, but in someone who's already restricting carbs and being very careful with that, and it's just out of proportion to how they're eating and how they're exercising, you can see that along with the elevated lipids or triglycerides a lot of times as your indicator of like, okay, there's some other process going on and it's not just about diet. Another one that I do here in the States is a Candida immune complex or a CIC, or I run some of the Candida antibodies. They tend to be covered. Candida not being mold, but it is a fungal issue. And a lot of times in that patient who's going to be sensitive, a lot of times I am seeing Candida overgrowth in their gut. And this can be a good indicator of like, do I have more of a fungal tendency in this patient? Because these tend to be elevated.
Great. Yeah. Thank you so much. That's a great little starting point, isn't it?
Yeah. And then here's some of the Shoemaker markers. Now, but this isn't typically where I start. This is more if I've done a history and I'm thinking this and we're trying to monitor where things are at, or if we're already really suspicious of mold. So the ADH can be, a lot of times in our mold patients, we're seeing that urinary frequency, like they're just not able to concentrate their urine. And so measuring an ADH can kind of see, is there something happening there, which is all about regulating water reabsorption. An MMP9, I think of more as a chronic inflammatory marker. Definitely, it's an inflammatory marker that's caused by exposure to toxins. So this could be Lyme biotoxins. It could be mold mycotoxins. So that normal range goes up to about 300. The higher it is, the more in trouble your patient is. And I've seen some people, where their MMP9 is 700. That person's in trouble, right? And this marker doesn't change as fast as some of the others. So it's not something I obsessively track. But it is a good starting point to go, okay, there's inflammation is the part of this person's issue, and we have to figure out it's probably toxin related. C4A is a great one. Normal's less than 2,800. We want it sometimes even lower than that, but man, this one can go high. And this is acute inflammation that tends to be linked with mold. There are a few other things that can drive this too, but again, it's one of these things, you put it all together and you're pretty suspicious. TGF-beta1 will change faster than the other markers. So is one that you can measure more often, but is at least here in the States, and I don't know about there for you, they've changed the technology and the units for how they're doing this. So normal used to be less than 2380. Now they've changed how they're doing the test. The normals, I think, are less than 23 or 24,000, and the test has not been as helpful. I want to
this
say
is Quest you're talking about?
No, so Quest is better, and they're still sticking to the range. LabCorp has not been, in my experience, has not been that useful now.
Yeah. So there's very specific laboratories and so on that were always recommended for these markers, and sometimes the confusing thing is that the recommendations change, and then the laboratories stop sending it to various of the secondary labs. So it's a bit of a headache.
Yeah, I would say if you're here in the States, I would use Quest for these. It seems to be much more clinically useful and accurate. But the TGF-beta1 is more that acute inflammatory marker that can go up. And so we can see this sometimes being in the 20,000 level. I mean, I guess that's the highest I've seen it. It can go higher, but the higher it is, the more like active inflammation. And typically, you're thinking, okay, this person is still exposed to mold, or we have them on a detox protocol and they are mobilizing some things faster than they can keep up with. MSH is all about cytokine release. So we're looking, a lot of times this is very low in some of our mold patients. VIP is a similar one. In our mold patients, this tends to be low, and you probably heard about VIP nasal spray being used as a treatment. It's not a first-line treatment, but it's something I know they were even talking about for the cell danger response to think of with that. But a lot of times we'll see those VIP levels are low. VEGF is another one that tends to be low. And then HLA-DR is one I haven't done as much recently. I used to do it a lot when I first followed Shoemaker's. But you can find out, is this patient genetically more susceptible to mold or to Lyme biotoxins or some of these things? So I listed off some of the markers there. It's a fairly complicated calculation. You have to follow this little grid. So if you go to survivingmold.com, they actually show you how to interpret the lab results because it looks like complete garble snarf to kind of convert it over to this. But it can be useful, and some patients like to see that. But it's not the kiss of death. Even if they're that mold susceptible, both copies of their genes looking like that, don't get attached that they can't get better. And that's why I stopped doing it, because some people were like, oh no, I have the dreaded gene, I'm doomed forever. And yeah, don't get attached like that. It's all about how it's phenotypically expressed.
Yeah. And so, yeah, that's right. So if you only have one abnormal one, it's not that suggestive. But if you have multiple, like 3 or more of these markers abnormal, it's more suggestive. And it kind of at least tells you that you're in what I call the biotoxin quadrant. I don't find it necessarily helps you differentiate between Lyme and mold, or MCAS and heavy metals and mold, but at least you're in, it's not just something very basic relating to the microbiome and hormones and that sort of thing. There's something going on regarding biotoxins.
Yeah, and this person's going to need a lot more help with detox is going to be the thing. Yeah. All right, let's go. Okay, this is an organic acid test. So this is one from Mosaic, which is my favorite one. I think you pick one and you get used to interpreting it. But the thing I love about this, so this is what would come on your first page of an OAT. So very inexpensive urine test that you can do that gives you also other markers for methylation and mitochondrial health and glutathione production. But we get this beautiful snapshot of what's going on with our yeast and fungal markers. And if you're seeing elevations like this, now there's a few, you can see marker 2, 4, 5, and 6, and 9 are more mold specific. Now, this is almost like the early screening way of doing some mycotoxin testing. The other markers are more related to candida. And so you can see in this patient here, we have a lot of elevation. I am very, very, very suspicious of mold and probably some mold issues going on or fungal issues going on in their gut. And so if we were starting here at first glance, I'm like, oh, we got a mold issue we got to deal with. It will also look at some bacterial markers. There's a lot of other ones that it would look at there that I just didn't show on here. So it's a nice snapshot of what's going on with the gut health as well. Let's go to the next slide. The other test that's also included in that organic acid test and why I wanted to show it is about oxalates. So Sandeep talked about this just a little bit. So that marker 21, that oxalic acid, if it's elevated, now oxalates tend to be triggered by fungal and mold issues. Now, one tip that I learned is if we also have a high glycolic acid, that may be more of a genetic tendency towards making oxalates. So there might be a bigger issue. And oxalates, think of like this, like they're sharp, spiky little crystals, right? I used to do urinalysis in a lab before I became a doctor, and you could see sometimes the urine samples are full of oxalates. Oxalates are this sharp thing. So a lot of times this will present as eye pain because they're sharp, urinary frequency and pain, where it almost feels like you're getting a bladder infection, but it's not. A lot of times I see in children, they are bedwetting because it's just uncomfortable and they don't feel like they're going all the way. A lot of times sensitivity to almonds, spinach, kale, a lot of these high oxalate foods, they may have peeling skin, you might have Raynaud's, you might have some kidney issues, early osteoporosis, right? Because K2 is needed to make, so calcium's kind of bound up with these oxalates, but you can get kidney stones from that. But a lot of times the calcium's getting bound up there and not in the bone tissue. And so vitamin K2 is actually really helpful to treat the oxalates. And in our course, we'll do a deep dive into this and the whole relationship with the sulfation pathways. And when this is going on, you might be spilling potassium as well. So you might have some of the POTS symptoms that we're seeing a lot of times in our mold and our chronic illness patients. And potassium, they're finding, is so important for a lot of people with chronic illness because genetically there are some mitochondrial concerns that are really dependent on potassium. I think this is.
Yeah, just talking about this is something I came up with just talking a little bit more of a framework for thinking about testing And so we're not going to kind of be pushing the idea of you have to do Mosaic or you have to do My Myco Lab or whatever it might be. We want to give you a framework for understanding what all the different testing options are and which best fits your practice style. So which labs are available and which tests from those. I guess how to prioritize when it is helpful to test versus not. In some cases, you may be best to not test, especially if the patient is convinced of their problem. There's not other naysayer family members involved, and the person wants to prioritize saving their money for remediation or moving. So it's always worth asking the question, how does it change management? Or alternatively, is a test needed to assist with a family member's confidence in the treatment? Amy, well, we were talking about this the other day, but quite often you'll have a couple and one of them, which is often the woman, is suffering from mold illness, and the other partner, which is often a man, won't be on board necessarily, and that does creates a lot of stress in their life because one of them's trying to make all these moves to get away from it and the other's not on board. And so sometimes just having a test in black and white, or in color for that matter, can help that person to basically settle their nerves and say, okay, this isn't just some kind of paranoid delusion that my partner is suffering from. There's actually objective evidence of mold and mycotoxins in this case. So as we said, we can talk about which tests fit with your practice style. So, if you've got a room, if you're an MD or ND, it's more likely that blood testing is going to be easy and compatible with your practice style. While on the other hand, if you're working all virtual and don't handle blood specimens and so on, it may be that urine testing is most appropriate for you, or other types of testing. And then also legal cases is an important consideration. So not everyone takes legal cases, but if you're a licensed practitioner who wants to deal with legal matters, then in those cases, it's probably much more important to do extensive testing because you have to demonstrate causative links between the home and the illness, let's say. So those are a few basic concepts around testing I just wanted to throw in before we keep going with specific tests. Did you want to do that one, Amy?
Oh, these are you. These were you.
So so you did the organic acid, and then that's the mycotoxin.
The organic acid test. Yeah, you were going to cover the antibodies and mycotoxins.
Yeah. So basically, Mosaic also have the urinary mycotoxin testing. It's probably the one that's been around for the longest. They were previously known as Great Plains Laboratory, and so I think they test somewhere around 12 different mycotoxins, and it's considered to be one of the most sensitive ones because they are using the liquid chromatography. And we'll talk about all the differences between the testing methodology. But this particular test is definitely showing an elevated level of ochratoxin, although it is common to see a small amount, even in those who are not being affected by mold. But if we get very elevated levels, it is thought to be more significant. Now, this is Real-Time Laboratories. Again, it's another option. They do ELISA-based mycotoxin testing, and these are the main 5 groups that they look at: ochratoxin A, aflatoxin group, trichothecene group, gliotoxin, and zearalenone. And so in this case, all 5 were present. And so it can give you an indication. Again, it may just be for a family member to say, oh, wow, yeah, you've got mycotoxins showing up, all right. But I will just say, if you've got the history that they're definitely being exposed to mold, then you already know they've got mold. So I guess you need to think about what question are you trying to answer. Now, one answer may be, okay, which specific mycotoxins, and do we need to use things like NAC and Saccharomyces because gliotoxin is present? So yes, in this case, it has showed up. So that could be one reason to do it, or to know how well they're excreting. the mycotoxins from the body, that can be another reason. But you don't necessarily need to do the urinary mycotoxin testing to answer the question, is my patient being exposed to mold or not? Let's throw that in. And then this is the new kid on the block, Vibrant Labs, and they're actually testing more mycotoxins in their test. And so they are splitting up the aflatoxins into subgroups, for instance, and they're looking at things like fuminescence, which I think the other two labs are not looking at. So it is a newer one, but some people are finding benefit with the Vibrant Lab urine mycotoxin testing. Now, this is another relatively new kid on the block. This is serum mycotoxin antibodies with MyMycoLab, and Dr. Andrew Campbell is the medical director. And so they look at IgG antibodies and IgE antibodies. And they're both thought to be indicators of current or recent exposure to mycotoxins, but the IgE is thought to also indicate possible mast cell reactions. And they have a lot of explanatory info in the test. And then this is a test I've started using recently, which is serum mold antibodies, and the laboratory is called Allertest. And I think the website is just foodallergy.com, because they do a lot of food allergy testing as well. I was actually put onto this by some of the doctors from the ICI group, which is the International Society of Environmentally Acquired Illness. And they mentioned that they had found this test to be very useful. And it's actually a lot more affordable than many of the other tests. So it does indicate, especially if you see high levels, like a lot of 3+ and 4+, which are denoted in this pink shading, usually that does correlate to high levels of exposure. Then we've got some other funky testing, especially for those in Europe. This is IGL Laboratories in Germany, where they're looking at quite advanced mitochondrial function markers, such as looking at the ratio of ATP versus ATP MAG, and ADP to ATP conversion efficiency, blocking of active sites, etc. So that's a very interesting test. They also do adduct testing, which is which can be affected by various different types of toxins, but you can look specifically for mycotoxins. And the beneficial thing about that is you're not just showing the presence of mycotoxins, you're actually showing that they're having an effect at a cellular level. So that can be useful, and it's something that I'm starting to do. And then we've got Armin Labs, which is quite commonly used as a laboratory for tick-borne infections, are also starting to do a serum mycotoxin test. It's not antibodies, I don't believe. It's actually the mycotoxins themselves. And so they're testing 5 common mycotoxins, and they refer to it as the Toxiplex basic test. So that's a very quick run through of testing options. So we're right on the hour. What do you think, Amy? Do you think we jump into this, or maybe just do questions?
Why don't we jump into questions, and we can always circle back to this and do another module onto treatments.
Well, yeah, we can also quickly just cover, for those who want to know what this course involves. Shall we just do a couple of minutes on that? So you can see some of the slides here from the Mold Illness Mastery course. So we've got around 16 modules, and each of those modules includes video lectures and resource materials. So this is going to be, at least initially, a weekly live program with Q&A. So there'll be like an hour or an hour and a half every week where you can tune into a Zoom call and basically get to ask Amy and or myself. May not be both of us every week, but definitely there will be some weeks, and we'll answer any questions you have about that particular module. And there will be a private Facebook group. And the topic of that is the current module that we're covering in that week. So everyone moves along at the same pace. We're all covering those modules. And what we have is like a weekly recap video, or a quick weekly video for those who don't have time to listen to all the videos. You can just do the quick one and basically cover the module that way, and then you can come back to it later as required. But everyone goes through in the 8-week format, and at the end of that, you should be pretty confident with being able to deal with mold illness. So this one is this is the outline of the modules. Now, we've got a PDF document that we'll also post in the chat, just so you guys can, and thank you, Anna, she's already done that. If you want to download that document, you basically, it goes through all the different modules and what they cover. So it goes all the way from what is mold and what are the ways it can cause illness, all the way down to working with relapse and recovered mold-related illness patients, and everything in between. These are the times. So it's generally 5 p.m. Pacific time and 8 p.m. Eastern time for those in the United States. And for those in down under, that's going to be 11 a.m. Eastern Standard Time, which means Queensland time, or 12 noon Sydney or Melbourne time. And you'll see around about halfway through, just to be aware of this, daylight saving times finishes in the United States, so it's 1 hour earlier for the Australians. Now, if you're in the UK, on the other hand, it's going to be 1 a.m., unfortunately, for the first 4, and then midnight for the second 4. So our apologies to any English people here, and we'll make it up to you somehow, maybe by beating you in the cricket.
Yeah, but we also talked about, you'll have access to the videos, and there will be that Facebook group. So for any who can't watch real time, because I know that's also hard to work in, that you'll be able to send questions over to that Facebook group, and we'll answer it for everyone. Yeah,
thank you for that, Amy. So what we are offering for the next 5 days is this coupon, which will bring the course down to $3.99 US rather than $5.99. So thank you, Anna. Anna's put the link there for the actual shopping cart item. So if you think you would like to join, just click on that, and you can go and click checkout and then enter in the coupon code MIM pre-launch after that. And there will be a couple of little goodies we'll be giving to pre-launch members, which I think will likely be an ebook and a special webinar. Is that right, Amy?
That's what we were thinking. We're still in the middle of, we have our whole course outline, and we're in the middle of, tweaking it and doing that. So as little goodies come up, we'll definitely be sharing with people who've already registered for the course.
Okay, great. So on that point, we'll just start heading towards questions and answers. So let me stop sharing here, and we can go straight into this. Okay, so first one is from Scott Forsen. No, sorry, let me get the pronunciation right. Scott Forsgen. There you go. Hopefully I got it right. Will we be covering applications of OG, ozonated glycerin, in treating mold? Nasal spray, nebulized, oral, etc. Is that something you have come across, Dr. Amy?
I haven't been using that yet, but I can definitely look into it and make lots of comments on it. So I'm the one writing the big section on treatment, so I'll do it just for you, Scott.
Okay, so Candace's question I think we've answered already. Then we've got Ashley Good, who's from up my way in Australia. Just so I don't forget, I'd love to ask you about the efficacy of UVC trolleys for mold elimination, and also whether personal handheld water or moisture meters are useful for mold detecting. And finally, any recommendations for ERMI testing on the Sunshine Coast, Queensland? Do you want me to do that one?
What was the first part of the question?
The efficacy of UVC trolleys for mold elimination. Not a term I've heard.
What's a trolley? I'm sorry, I haven't heard that term.
Yeah, I haven't heard that term either, but I'm going to...
IV UVC, I'm using that.
Okay. No, I doubt she's talking about that. My guess would be that she's talking about photocatalytic oxidation filters for mold. Let me know if I got that wrong, Ashley. But if you're talking about photocatalytic oxidation, they can be useful. However, one possible downside is the production of secondary byproducts.
Yeah.
UVC in general, made by Philips, If it's just UVC, I think you've really got to be careful about the byproducts that are being produced by that. Same thing with ozone, because although the oxidation can definitely oxidize the mold that's there, it can also release a number of byproducts, including spores, etc. So that wouldn't usually be recommended. She said the UVC trolley in particular was used by an acupuncturist here on the sunny coast. There you go. But in general, that wouldn't be like a first line option that we would go for.
One thing we'll be presenting in the course, and I'm gathering some information now because I ended up, Children's Hospital here in Seattle ended up having a mold issue in the hospital ward, and it was like a huge issue, you know, a couple kids died and everything else. And they ended up putting a unit in there as a filtration system to make sure that it was purified from mold. I put a similar unit in my home, which has been great until the water damage was right next to where my filter is, and then blasting through my house. But I seem to do okay. But there's quite a few options that actually seem like are first tier, second tier, third tier based on your cost. And so that is actually a whole section that we'll be presenting in our course.
Okay, and then Scott again saying, I thought IGL closed a couple of years ago. Did it reopen? I actually just looked it up yesterday, and it appears to be an operation. I did have a patient go over to Germany, and when she went over there, they were not open. So I don't know what's happened there, and it does appear there was a break, but they do definitely appear to be offering something at the moment. I couldn't find the DNA adduct testing on their site right at the moment, so it's possible they've gone through some changes and are their offerings are slightly different, but they definitely seem to still be advertising services. But if you have any further updates, please let us know. That's all for questions.
Right.
So that's great. Yeah, did you want to go back and do anything on treatment, or are you happy?
I mean, we can go through that if anyone was really wanting that. We might as well go ahead and do it now if anyone likes to stay. Because
at least people that need to go, at least we've covered their questions. And those who are able to stay on, we're going to just do a little bit on treatment. Yeah. And I'll hand back to Amy.
Yep. So when we're thinking mold treatment, I usually put things into 5 broad categories. We're thinking binders for the toxins. We're thinking antihistamines or those type of things for mast cells. We're thinking antimicrobials to address the colonization or the actual growth that is happening. We're thinking detox support and drainage, which could be methylation support, liver support, a lot of those types of things. And we're thinking general anti-inflammatories, different from the antihistamines. Okay, next slide.
Mm-hmm.
And kind of on that thought of like the 5 general things, I usually think of when I'm putting a plan together for someone, not everyone needs all 5 categories supported, right? They might be doing really well with excretion and they may not have colonization. So different patients will do different with better things. And sometimes what you'll notice is someone has responded, like maybe 90% of your patients respond to your protocol, but the one person who doesn't, you can go back and think, well, maybe I'm not doing enough binding or I'm not doing the right binders or whatever that is. So accumulation of toxins are happening, right? The symptoms are there. Essentially, the person's cup is full and they are overflowing. So all of a sudden you get to a point that you can't handle anymore. You become more sensitive to fragrance, to EMFs, to pesticides. You can no longer go into Home Depot without getting triggered. You're sensitive to chemicals. You become very reactive. I see a lot of my mold patients all of a sudden becoming very reactive to foods. If someone's coming to me and they're reactive to almost everything and their list of what they're eating is a shorter list than what they're not, or of what they're able to eat is like a short list that you can count on one hand, that to me is a big indicator that there's a mold issue going on. So our primary treatment strategies are going to be binders, drainage, liver detox support, helping with that bile flow, just to get those toxins out of the body and supporting methylation. So this is really how we go after the toxins. And we'll go into this in depth in the course. Like this is, several hours of lecture. Common binders. Now, one thing you'll get in the course that is a work in progress actually amongst a lot of the experts out there, and we've been gathering a lot of information, is the specific binders for each specific mycotoxin. So let's say you ran those urine mycotoxins and you have a few that just you can't get those numbers down. Then you can pick and choose. But some of the main categories are going to be zeolite. Charcoal is probably one of your all-purpose sort of binders. It's trapping, the whole goal of a binder is it's trapping toxins in the bile. So things that have been already excreted in the bile flow into the digestive tract, we want to mop them up with some sort of binder that's going to bind that up so it carries it out in the stool and it doesn't reabsorb. That's the whole thought of a binder. So this is very dependent on, can this patient actually get that bile flowing and get those toxins out into the digestive tract in the first place? And are they pooping? I mean, that's actually a huge issue with a lot of our mold sensitive patients. Constipation is very common. Don't ask someone just like, oh, how's your digestion? And they're like, oh, well, it's normal. Ask them, how many times a week are you going? And I would phrase it like that rather than how many times a day, because it's setting the tone that you're okay if they say that they only go once a week. Because otherwise they're like, oh, yeah, sure, I'm doing whatever you say. But it's not uncommon that actually some of my sickest patients are moving their bowels once a week, once every 2 weeks. I mean, it's horrifying. It's not going to be about putting more supplements in them. We have to figure out how they can start eliminating better. Bentonite is another one. There's lots and lots of combination products out there, and we will talk in our course about some of our favorite combinations. We're not, because this isn't a CE course, the nice thing is we can actually talk about like, what are we seeing, what's tolerated, what seems to be more useful for certain things. But I want you to know the individual ingredients so you can help to go, hey, is this a good product, for this patient or not? Benfotiamine, which is a fat-soluble B1, also really helpful. And this is something that Sandeep turned me on to. I've been using B1. I think of this for like the gateway to the mitochondria, right? So whenever cell danger response is happening and mitochondria aren't functioning, we have chronic fatigue. We're basically not making ATP. Our stamina is low. Our ability to actually give enough energy to methylate and detox properly isn't there. But B1, you can think of this also as a binder for some of these mycotoxins.
With my thanks to Elliot Overton for putting me onto this.
Yeah.
He interviewed me a couple of times last year. Great guy in England.
Incredibly well tolerated too. Like I've used this actually in children on the spectrum to help with speech for at least 15 years at like 100 milligrams twice a day. But I use it a lot in my chronic fatigue patients. Right. So Saccharomyces and spore probiotics tend to be good. And then go back 1 second. And then glutathione and astaxanthin. So I was just talking with Jill Krista, and their mold IQ study has really found that astaxanthin and some of the bioflavonoids may actually be some of our better binders than some of these others, and really great if someone tends towards constipation. So the astaxanthin is going to help with excretion, but they were actually finding some binding capacity with that. So incredibly well tolerated. Glutathione is going to turn on someone's ability to like get some of these toxins out of the cells in the first place. Not everyone tolerates it internally. Sometimes topical application of glutathione can be better, or nebulizing. And then be careful with probiotics. So Saccharomyces can be fantastic. Spore probiotics can be good. Some of the others can be triggering. So you just, go on a case by case basis.
Oh, great point.
All right, next slide, please. So allergy and mast cell activation. So some possible symptoms, right? It's not always as obvious, but there might be that immediate reaction to food. So this is the person that might get really anxious or nervous within 20 minutes of eating, or maybe they get that red blotchy skin like we see there in that picture. They just feel a little bit itchy. But mast cells are very excitatory to the brain. So a lot of times, like how this presents in kids is they get wild after they eat. They're acting out, sometimes flushed cheeks, flushed ears, but really hyperactivity. Or sensory issues like the sound sensitivity, the light sensitivity, a lot of that. And you can just have heightened environmental reactions. So that's showing a skin test. But, sometimes people will have that dermatographis where you just rub your fingernail along your arm and it leaves a red line. Like you could write your name on there. That's typically an indicator that there's a mast cell issue. But it tends to go along. My mast cell patients tend to be quite anxious, tend to be a little skinny. Yes. Sometimes they have the allergic shiners. They have, it's not always the itchy eyes, runny nose, but sometimes it is.
Right. Super reactors.
The super reactors. And you tend to react to eating quickly.
Right. Okay.
Kind of, it doesn't matter what you eat. So mast cell treatments, I just wanted to present a quick little overview of, again, there's multiple ways of approaching this. And sometimes, people are like, well, I tried Benadryl or I've tried Zyrtec and it didn't do anything for me, so it's not a mast cell issue. Well, we might need a little bit of everything to stabilize someone, especially if they're really that, like the super reactors. You may need to address all of these routes for mast cells. So our H1 blockers are things like Zyrtec or Claritin. Our H2 blockers, so this would be famotidine, also called Pepcid, which we think of as an acid blocker, but it actually works really great. I just take it at bedtime. I haven't seen it interfering with digestion. Also really great for post-COVID. If you're in the middle of COVID and having a lot of inflammatory stuff, this has been a game changer. Mast cell stabilizers like cromolyn and ketotifen, which are both prescription, or quercetin, which is an over-the-counter that you can take before meals. These can be game changers, especially for these fast reactors to eating, that they're having these things, or if they have inflammatory bowel disease. I find these to be really helpful. Tryptase inhibitors, there's an interesting product that's from quail egg called All Clear from Integrative Therapeutics. It's just one of the tryptase inhibitors, or DAO enzymes, which are going to stop the release of histamine before it happens. So again, this is something you tend to take about 20 minutes before a meal. So there'll be a whole section on this, but just in general, kind of the lay of the land.
Yeah, that's great.
And then colonization, Australian spelling. Usually we're thinking gut, or we're thinking sinuses, or we're thinking lungs. And a lot of times there'll be symptoms pointing to that. Now, not everyone has colonization, but very commonly they do. And so treatments are often going to require antifungals. And, I'm a naturopath, but I use a heck of a lot of fluconazole and itraconazole, which is Sporanox, and diflucan. So I use a lot of prescription antifungals, some herbs that I really like.
So this is funny because I don't really use very many.
Oh, I use a ton. I know I'm a bad naturopath, slap me on the hands, but they work, right? But I also find that neem is helpful. Caprylic acid, undecylinic acid are helpful. Saccharomyces can be helpful, or it can be triggering, kind of depends on the patient. I don't know, are there some herbs that you really like? Just single herbs?
Yeah, I like thyme, nigella, powder arco, golden seal. Those would probably be the main four. Also, reishi mushroom.
Reishi?
Yeah.
Interesting.
There you go.
Yeah,
But it also seems to help with shifting the TH balance back to TH1.
Yeah, I definitely use it for that. I'll think of it for mold. And then nasal sprays. If you're thinking there's a sinus issue, get that out of there. But the other thing I would say is, a lot of times think of a big pile of infection in the sinuses. I have a patient whose dad was an anesthesiologist, and he worked on a lot of sinus surgeries, and he said it's very common, like 9 times out of 10, they were pulling fungal balls out of the sinuses that wouldn't show up on CT scans in advance, and often weren't even commented on in the surgical notes. But it's a very common thing. And so if we have a pile of infection in there, you can put a spray in there, but you're just getting to the surface. So I would really be thinking about something like a neti pot or a neti rinse that's actually going to move some of the bulk of that out of there. But some of our nasal sprays, like I particularly like things with propolis. I do use some prescriptions. I find colloidal silver products can be really good. I'm trying to think. There are some with essential oils and ozone that I think are great, or sometimes we do nasal insufflation with ozone. Anything that you find particularly helpful?
Yeah, so I think propolis is something that's used via a diffuser device, and there's actually a T2 product in Australia here, which is called 98 Alive, that I use via a nebulizer. That seems to help people a lot in clearing it up. I use it myself as well. But all those other things you mentioned as well, xylitol nasal spray as well.
Yeah, xylitol like X-Clear can be really helpful, and you can actually there's a trick that you can take X-Clear and put 5 drops of biocidin into a bottle of X-Clear, which is the xylitol. And that actually works really fantastic. If you're going nebulized, you want to be really careful that it should be a sterile solution, but nebulized will get, will permeate a little bit more than just a spray.
Yeah, definitely. Okay.
There it is. Now you're all ready to treat.
Yeah.
That simple.
Okay, well, I hope people have got a lot out of this. I think we just had maybe 1 or 2 lingering questions here. If we can just finish off Ashley's question here about personal water meters. So as far as I understand, she's talking about like moisture meters for a home, right? And so they're very useful. Yeah, I mean, you can get them for generally $20 from Amazon or something like that, and they just give you the humidity in your home. And generally speaking, you want to keep that between 45 and 55%. Now, if you live somewhere like us, subtropical here, pretty much everyone's going to need to run dehumidifiers. But you also don't want it to be too low, otherwise you're going to be at risk of condensation. So anyway, yeah, I think they're definitely worthwhile if that's what you're talking about. ERMI recommendations for the Sunshine Coast. So you can send it to Mold Lab, I believe they're called, in Newcastle. But if you're talking about inspectors, the mainstay of inspectors is Rachel Davis from Equilibria here on the Sunshine Coast. What is the best way of using colloidal silver? I have a small unopened bottle and would love some guidance. You can take that one.
Yeah, sure, I can take that one. So orally, I would say, I mean, it depends on your parts per million. So if you're using something like Argentin or ACS or like a, not a man-made, or I guess not man-made, that's not the right thing, not a homemade product. It's usually a teaspoon twice a day if you're going orally. I do like, you can nebulize with it, but you can also just use it as a nasal spray. A lot of the preparations can just do it that way, but oral is fantastic. You can put it in a little bit of water. Yeah.
Right, thank you. And then Gary says, any experience using chlorine dioxide?
Yeah, I it's you.
Yeah. Not specifically for mold, all types of infections. I actually find it quite good for SIBO. Sometimes when you don't know what the infection is, when someone's just got a big fever, chlorine dioxide can be very useful. Cancer, so it's got a lot of different applications.
Yeah, so using it internally can be good. I really like the chlorine dioxide actually for, like, there's Room Shockers by Biocide Systems. That's chlorine dioxide. Those I find really helpful. It can also be good for other fumes in the house, like paint fumes and those things. And I've had people aren't too triggered. So, a lot of times I'll have it and it's very inexpensive. It usually covers 100 to 300 square feet, or you can use it for the car. They make a car one that's really nice.
Mm-hmm.
I am actually using a lot of kind of similar, the Briotech in kind of vaporizers for the room. I'm finding that's really good. And that's what I use as a disinfectant in my exam room in the clinic.
Okay, great.
Similar.
And then Finn, he's an ART teacher out here in Australia. He's just saying there's two files. One has 16 modules and the other has 8 weeks. So basically what we're saying is we're doing two modules per week. So you guys are going to keep up. Go fast.
Yeah.
I think that brings us to the end.
We're discovering that we're both talkers. So whoops.
Yeah, that's right. Let's see who will keep us under control. No probs. All right, guys. And I think that's pretty much it. So I really hope everyone's got a lot out of this. And thank you so much for joining us today.
Yeah. Why don't you leave on that slide so they can see the code?
Okay, yeah. Let's just put that back up. That one?
That one. There we go. Perfect.
Great.
Great. Well, thank you for joining and giving up your evening or your daytime there.
Right. Bye for now, guys.